And how is it generally rendered in other states outside of Tennessee?
Well, other states have several tiers of personal care where you could have a healthcare provider to provide you with a person, a nurse or a certified nursing technician to do your personal care. Then other levels are where you hire your own people from the community to do your personal care, and you train them. And then some states actually pay family members to do personal care, and of course you do the training. So there are all different scenarios there that can be used for the benefit of the individual with a disability, and I can't say this enough, for the taxpayer.
Well, now, do you believe that the state is aware of this? I mean, is there enough information in terms of presenting this information to the state?
I think so. We've worked really hard with legislators to get this done, but I hate to say that we've not had a really positive response for a wide range of programs for individuals. And I think it's because of the huge nursing home lobby. The nursing home industry spends tons of money every year to, in my estimation, suppress our efforts to put these programs into practice.
Well, now, the nursing home industry would generally receive its money from Medicaid and Medicare.
That's correct.
And whatever, and so what you're suggesting is that perhaps because they're able to receive this $45,000 example that you used, they would rather keep you in the nursing home for $45,000 than to allow the government to pay $20,000 to keep you at home. Is that what you're suggesting?
Well, that's not what I'm suggesting. That's what I'm saying emphatically, is that that's what's going on. It's a nursing home state. The nursing home industry is just that. It's an industry. They're set up to make money, and that's all it is. And so I think that's why they're throwing up barriers to doing that. I think, though, you know, they've used excuses like, you know, if they let too many people out of nursing homes, then, you know, it's going to cause them people to lose jobs, the caregivers and whatnot. But that's not actually true. If a person lives in a nursing home, you've got one nurse taking care of 12 to 14 people maybe. But if you let a person live at home, it's going to create a whole new industry. Because now, instead of having 1 on 12, you've got 1 on 1. So you're going to need more nurses and more nursing technicians. So it's actually going to create jobs for people. You know, and in my estimation, that would be an opportunity for the nursing home industry to go into the home health industry and actually expand.
Broaden what they're doing.
They're broadening what they're doing.
Warehousing people essentially.
Thank you.
Is that, that sounds like
that is exactly
situation
the word
that you're explaining,
yes, sir.
defining. But it would be cost effective if these individuals could get out of.
It would be.
Do you believe that there are a large number of individuals in these situations who would like to be at home and would like to be out of the...
In the 2 nursing homes that I lived in over the 5.5 years, 95% of everybody that I talked to said that they would have rather been at home, but they didn't have an option. They'd either outlived their children or they didn't have any money to pay for personal care at home.
Okay, I would imagine that we've got about a minute and a half to go here, Mr. Stewart. Let's see if we can have you over the last minute or so sort of summarize and give some final comments in terms of what you'd like to see done dealing with this issue.
Well, what I'd like to see is the state to stop creating pilot programs which limit the amount of funds that can be used to put these to do personal care. I'd like to see the states do like other states, open a broad statewide program, bring in the Medicaid funds to free individuals from nursing homes, and keep individuals that are already living in the community struggling from going into nursing homes. That is really the cheapest way to do it. It's harder to get them out than it is to keep them out. I would like to see the state fund more assistive technology, you know, for people to be able to to live at home.
Very good. And of course, Mr. Floyd, let me thank you over the last few seconds that we have of coming by and giving us that excellent information today. And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.